Good evening, guys, and I'm very happy and privileged to introduce Dr. Abhishek, who secured rank number 2 in this NEET SS. Abhishek, congrats first of all, and welcome.
Thank you.
And how do you
Thank you,
feel,
sir.
Abhishek, right now? It will be a great feeling.
To be honest, I still can't believe it actually.
There's
But
no, there's no like that because you were always shown your academic brilliance because you in I'd seen your CV that you got multiple quiz prizes in UG level onwards, and you were the
yeah,
best.
yeah,
You got the college topper as well as a winner of some hematology quiz as well as even
yeah.
the university. I
I've
think
always been interested in quizzes and all that.
yeah.
It has always attracted.
Even your UG and PG entrance exam also you got a really good rank, and you did your UG
Yes,
as well as
yes,
PG from Lokmanya Tilak, and to get into Lokmanya Tilak
yes.
also a difficult thing because that is one of the premier institutes in the country. So
Right.
can you? I just told the brief introduction. Can you introduce yourself? Where are you from, and what are your family members and details of that?
Yeah, sure, sir. So hello guys. My name is Dr. Abhishek. I am senior resident working currently in Lokmanya Tilak Municipal Medical College. I've done my UG as well as my PG in MD Medicine from the same college. And I actually hail from Aurangabad, which is a city in Maharashtra, and I'm the first doctor in my family. So that's a big achievement for our family, and I'm proud of that fact. At least, if not this NEET SS result, the biggest thing I think I have achieved is that opened. I've basically broken the barrier for future generations which will come in my family. Yeah, so that's what I think.
Even
All
I am
my
the first.
family members are proud of the fact.
Even I can understand that. Even I was the first person to get MBBS in my family also.
Yes, 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 definitely, definitely.
And how was you finished in last year and you were doing a researchship. So how do
Yes,
you
yes.
feel now? How was your preparation for exam and need? How did you prepare for that?
Yes, sir, the basic source I think all of us can agree is Harrison's only. Harrison's. So actually, our batch was the unlucky batch. If you are following the current discourse which is happening, because we had a first year of about 1 year and 8 months. We didn't have any juniors because of the COVID second wave. NEET PG had gotten delayed,
Yeah.
so juniors hadn't come and all that, and we were overworked at that point of time, so we couldn't study a lot. So basically, in my third year, I had 3.5 to 4 months only to prepare for my PG university exams as well as NEET SS. So it was quite difficult, but I'm glad that I've achieved something now. So yeah,
Not something. It's a great thing to achieve to get a volunteer rank too. and
still can't
and
believe it, sir.
yeah. But that is because that proves your academic brilliance. I was seeing your CV. I could not tell all the accused. You got some 3, 4, 5, 6 QC details like you got second prize, first prize, winner of this thing. I got a huge CV for you. And
Yeah.
how was preparation? Was you told that was based on Harrison. How did Marrow helped you as a soul? How was your journey with Marrow?
So, like I said, sir, 3.5 to 4 months is a very short time to prepare for such a vast exam,
Yeah,
especially considering medicine and allied subjects, which were asked in more proportion this year as compared to previous year papers, like dermat and psychiatry. So, it is a difficult preparation, and that's where Marrow came in, um, because it streamlined my approach on what I need to focus on and what can be done a little later on. Rakesh sir's videos, your videos, many of the super specialty faculty, they had some brilliant videos on, the basic fundamental topics like heart failure, MI, stroke, which we know how to manage. But the academic points of it, like uh, supposed contraindications for something, or criterias or sub criterias of something, which are very frequently asked in these NEET SS examinations. That's where I think we lag behind when we are not studying or when we are overworked with overstressed by the work of residency. So that's where Marrow was fundamental in improving my concepts, I think.
Yeah, and we actually this time we have introduced this high yield topics. Did you have gone through that high yield areas? This was the first time we were doing
Yes,
that. Yeah. How was it
that
helpful? And
yes, sir, it was a huge help. I watched all your videos in high end also. No, to be frank, I had not read narcolepsy and sleep disorders in properly. Uh, I knew about them, the basics of them, but not the nitty gritties and the fine points like what's narcolepsy, one narcolepsy with catalepsy and narcolepsy without catalepsy and all that. So that was a huge help. Rakesh sir's videos on nephrology as well as rheumatology. Nishant sir's videos on the basics of the high yield topics, basically antiplatelet drugs and all that. And I also watched the recall videos to get a sense of how questions are asked in NEET SS examination rather than going in blindly, which
yeah,
would have caused a lot of wasted efforts for me. Yeah.
actually that is I also suggesting many of you that you should first watch the recall videos before starting preparing because you should understand
Yes.
the
Yes.
and
Yes.
patterns. Not about the question may not be exactly correct in the recall because we are getting it from those who have written the exam. We got at least some part of the question. The main thing is not studying the question, not even the
Mm.
concept, how they frame the question.
Mm-hmm.
That is more important.
Mm.
And
Yes. 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 Definitely, sir.
that will definitely then you can go forward with that. Is this is for those who are watching for next year exam, and out of all, like you told that you followed high yield videos because we started high yield videos because Marrow videos are a little bit lengthy because we try to
Yes.
include more conceptual things. So we got a request that we need to make it shorter, and for neurology it is very difficult to make it shorter for me because
Yeah.
neurology is a subject like that. And I
Yes.
tried to make it as shorter. I followed only the previous question patterns and made it shorter. And so you follow to that. So you have any suggestions regarding any other add-on to the Marrow videos? You want anything else to be added or anything need to be changed?
Um, Sir, it will be difficult for me to comment on that. Number one, because it's a very fine balance of things which is required. You just said they were lengthy, but they were detailed, right? And they covered everything that is to covered everything that is to know about that particular topic. That is also required, and in-depth knowledge is also required of the topic. Otherwise, you can't approach MCQs because you have no in-depth knowledge, right? And you can't
Yeah.
rule out A, B, C, D, one of the four options which you feel is correct. So, and at the same time, you have less time to prepare, so you need shorter videos or shorter material to maximize your revisions. So, I don't think there was anything lacking in the Marrow SS videos, to be specific. In the high yield, I think not in neurology, but I think maybe in hematology and in somewhat in cardiology, some other topics could have been included, is what I feel
Okay.
personally. But apart from
Okay.
that, neurology, rheumatology, and nephrology was great, excellent, in fact.
Okay. Yeah, we want the feedback because we need to continually correct ourselves also. And how did you use Marrow question banks, Q banks? How did you use it? And during especially in the last time as well as during residency, there will be two part. Like one part is your residency, first year, second and third year. And I think that first year and second year in when you especially when you're in a government medical college, you can't think about much preparation. You have to go to your ward works, your routine studies, and
Right,
everything. So, and
right.
maybe towards
And the rest of the
second
time you have to sleep.
year. So in between your second year, I think COVID will also hit you.
Yeah, yeah, yeah. Yes. We didn't have a second year to begin with, but yeah, the what was supposed to be our second year, basically. We just skipped second year and became third years directly, as per our faculty at least. So, yeah. So regarding Marrow question banks, the maximum I've used is in the last 4 months only, actually, and In terms of using it, actually, I think in retrospect, I could have utilized that resource much better than what I have done, because I didn't solve any Marrow question banks during my residency. Call it the lassitude of residency, or I don't know, being overburdened, or being lazy outright. I don't know. But during the last 4 months, I think I utilized it the best I could. I'll be very frank. I couldn't solve all of them because they are quite detailed and the solutions are excellent, and they are definitely detailed. One thing if I could make a suggestion to you, sir, is the general medicine question bank, which was good, but I think in my opinion, it needed to include a little more Harrison's and a little less super specialty textbook level knowledge. And the SS question bank, obviously, it contains super specialty level knowledge, so that is well and good. I mean, 5 out of 5 for that. But Harrison's based question bank, proper Harrison's based question bank, like line to line, everything is required, because that's the type of questions they are asking nowadays, is what
Yeah.
I feel.
Yeah, actually, the question pattern, the biggest problem which when like somebody told me to make a high yield from the Marrow side, the
Yeah.
biggest question which hit me that is every year pattern keep on changing. Like first NEET SS, then when
Yeah,
they it was very difficult. The second one was again difficult, and all the question banks, if you go through the equals, you can find out that the pattern is keep on changing. This time, if you see the neurology
yeah,
part,
that is a real problem, sir.
many
That is
questions
a
from
very,
pain. I didn't expect questions to come in that area. I don't think much people have
yes, yes,
expected
yes.
questions coming from that. So the question pattern you cannot believe. Only thing is you have
Mm.
to go through the stuff. That is only possibility.
Yeah,
And
yeah.
how was like how why, and what is your plan now? Like you got all India rank to you can choose your subject. You have the independent freedom to choose your the choice of subject as well as place. So what is your plan?
Yes. Sir, to be very frank, yeah, I was very confused between nephrology and rheumatology till the end of my residency. Because in
Okay.
Sion, in LTMGH, we have a very good nephrology program, which is headed by Dr. Trivedi. So I learnt a lot in my nephrology rounds as well, and that's what attracted me to the subject initially. But later on, as I found out where my skills actually lie, which is in diagnosing and treating rather than intervening in some way, like um, taking someone for dialysis, putting lines, getting biopsies done, and all that, which is what the reality of nephrology is. So I found myself getting more attracted to the clinical fields during later half of my residency, like endo and rheumatology. Rheumat, I feel, is an extension of general medicine, is what I feel. Since in order to consider a rheumatological cause for a particular presentation or a particular set of symptoms, you need to rule out everything which is non-rheumatological first. So that's what excited me and attracted me towards rheumatology, because primarily I am a lover of medicine, general medicine, internal medicine, whatever you want to call it, and that's what drove me to choose this field in my post graduation, and that's what still drives me to further my skills in enhancing patient care and getting better at what I do.
Yeah, and that is one thing I had been seeing in all the toppers. Like most of the toppers which I had talked in last 2 3 years, I had interviewed all of them. The fundamental specialty they like is general medicine, and there are.
Yes.
I had seen a few classes students who joined general medicine to take a super specialty, and that inclination I feel should not be there. Inclination should be there
Yes.
towards internal medicine or general medicine,
Yes.
and then you select a topic after joining the general medicine, because like you were telling, you're like your nephrology faculty. There should be some teacher, someone who will inspire
Yeah.
you. That will pinpoint you towards which specialty you want to take. And nephrology is one specialty has so much close relation to rheumatology also. So that may be the
Yes.
reason why
Yes.
you may have inclination towards rheumatology also.
Yes.
And
And my guide and my HOD, Dr. Karnik sir, is a core clinician at heart. So
yeah,
he's the one who will consider a holistic medical aspect of everything. Like multi-system presentations, and don't just focus down on one specific system. Do a proper clinical examination. Look at the hidden signs. Look for hidden signs. Don't just rely on investigations. He's that kind of a guy, and that is what made me fall more and more in love with general medicine, I think. So one great contribution he has made to my life.
Yeah, I just want you to disclose one thing. Like it may help those who are planning
Yeah.
for next year. So you were having a busy schedule, especially during the COVID wave, and you were having a very busy schedule in a
Yeah.
hospital. So how did you
Yes.
manage
Definitely.
prepare for your MD exam as well as for the NEET during the initial time when you are doing the
Yeah.
residency? And then
Mm.
after that, how did you plan for the NEET exam? And what was whether you have a
Mm.
plan for INA? Three-part questions. One is during during residency, then during your SRship, then
Mhm.
what is your plan for INA?
So you may not like the answer because in first year I didn't really study at all. So,
Yeah,
but that's not what you should do, whoever is listening, because this is the time, and this is the time when you will see, you'll get to see everything. Like at 3 a.m. when you're doing some CTOs for a patient or writing orders for a patient, at that point of time, some patient starts having breathlessness, and staff asks you what to give. That should come instinctively. This is a patient of heart failure, he needs Lasix. Basically, good teachers and a heavy institute, an institute with a high case burden and a variety of cases. That's what was helping me learn in first year, since I was not studying. So in third year, I was using up to date mainly as my source of academic, as my source of knowledge. Um, as I was seeing patients on rounds, or as I was evaluating patients and treating patients in the emergency, in the casualty, and as I was evaluating MICU ICU patients, up to date was there at all the time to clear my doubts. What is the creatinine clearance, and how should I adjust the doses of meropenem or any other antibiotic and all that. That's what helped me in my third year. Towards the end of my third year, I started reading Harrison's properly, as it should be read. Otherwise, there was some sporadic reading of Harrison's also, which was going on. Like suppose a particular topic like diabetic ketoacidosis, so I took up Harrison's and read it whenever I found the time. So that's how I prepared.
yeah. And what was when did you start with using Marrow, and what was preparation during the NEET time?
So yeah, Marrow I did buy in my at the end of my first year, but as I told you, I didn't have enough opportunity, or I had enough opportunity and I didn't use it quite well to utilize Marrow to the best of what I could have used. But in towards the end of my third year, like say 4 to 5 months before the exams, I started using Marrow full fledged, and started viewing the general medicine videos mainly. And wherever I had confusion, or wherever I thought the general medicine videos were lacking, Rakesh sir's, I referred to the SS videos of it, and the super specialty videos and the notes which were in the notes column. And obviously, Harrison's was going on side by side.
Yeah. And among the and what was the plan for INA? Whether there was a plan for INA, you were preparing for next INA, obviously, right? You should have planned for that also, no? So what was the plan for that?
Uh, I
You felt
may,
like,
sir,
yeah,
because yeah, because the reviews. I've talked to some of my seniors, and they say PGI Chandigarh is good. So I think I'll definitely prepare for INA SS. I'll be frank. I don't have very much knowledge about JIPMAR and AIMS Rishikesh, which is one more seat for rheumatology in INASS. So I'll have to talk to some people and get to know the bottom of it. What's the program? What are they offering?
yeah.
But for right now, SGPGI Lucknow is at the top of my list, and second would be Hinduja Hospital in Mumbai. Those are the two final options I'm looking for.
Okay. So you will be planning for INA also. So you will be under
Yeah,
if things you have a plan for that also, right? So
yeah.
and what about like if you suggest that any any must watch things or must do things? It may be Marrow, it may be outside Marrow, for during the last 2 3 months.
So must watch things, Marrow recall videos. I think anyone who is starting preparations, Marrow recall videos they should watch for all the subjects, because that will tell you, give you an idea about how the questions are actually asked in the exam and what points you need to focus on. Like, for example, in cardiology, um, there's a last topic, congenital heart diseases, but the questions asked on it are minimal. So your efforts might be wasted if you're spending 2 to 3 days getting at the bottom of how congenital heart diseases are actually, how the pathology is, right? But you'll definitely score more if you focus more on heart failure, on cardiomyopathy, on ECGs, that sort of thing. So that's why recall videos, number one. Number two would be general medicine videos. I think for NEET SS, at least this pattern, general medicine videos should be done, all of them. And wherever you think they are lacking, because they're basically made for UG students who are preparing for NEET PG examination. Now they've made some modifications. So wherever you think they are lacking, and they will be lacking in some or the other topic, so that I think NEET SS videos will help you. And I think for rheumatology, because I was preparing for rheumatology, I viewed all the rheumat SS videos done by Rakesh Nair sir. So I think your subject of interest should be decided beforehand, and you should view all those videos also to get a better in-depth understanding of whichever subject you are about to take or about to pick up.
Yeah, like you are telling that especially you want to take, you have a specific interest towards specialty, and you have a
Yeah.
backup plan for INISS, you definitely should watch the specialty video separately, because
Yes. 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 Definitely.
you cannot prepare in, like after NEET I will start watching. That is not an option. You should prepare both simultaneously. If
Yes.
you are
No. No.
planning for
No.
IN, definitely you should watch
Mm.
the specialty videos. And
Mm-hmm.
it will be very nice to talk with you. And I knew that you told me that you are the first doctor in your family. Your family members will be extremely happy for
Yes.
you
They
crack a
are.
rank. That is something which is really, really great. Uh, and
Mm-hmm.
all of your teachers, everyone will be very proud of you. And please convey our
Yeah.
regards from Matt to
I
all of
just
them.
received a call actually before this interview from my guide. So he was extremely happy and congratulated me, and yeah.
And it is actually, I mean, it brings us also very, very, very happy to inform you that we are also very really proud of you. And you were actually really telling how you are very frank, like you are telling like how you gone through your residency period. It is exactly almost similar way
Yeah.
in most of the government medical colleges, which is very busy centers. There's exactly thing happening. First year, when you get time, you will be want some time to take rest or have food. That is only thing, you'll only your target
Yes.
in the first year. That obviously happens.
Sometimes
And
you'll skip food for sleep. That's what will
yeah,
happen. And you'll fall
and
sick. That's what has happened to me a lot.
And usually the second year time is a free time, but the second year, what happened to your batch is because of the COVID. COVID has taken your
Yeah,
second
yeah.
year.
That was a big blow to our academics in general, COVID. But it taught
And
us also, I think.
yeah, and all the best for you for your future. And
Yeah, yeah, yeah.
if you
Thank you.
want to write INI, plan for that also in the mind, and decide after discussing
Yes,
with your mentors in rheumatology. You can talk to Rakesh
yes,
sir, or you told that you have mentors in your own hospital, because they will be more closer to
yes.
you, because you were there for last 3 plus 5 8 years almost.
Mm.
Same college with UG now. It is like your home. So
Yes,
you can talk to
yes,
them
yes. I
and
know
decide on
every
it.
nook and corner now.
Yeah. And all the best for the all the future endeavors. And very
Yeah,
happy for you. Thank you for
yes.
coming for the interview
Uh,
also.
if I may just add one thing, if you have
Yeah.
the time, sir,
No
is
problem. Yeah.
a message to all those who are preparing right now, maybe in their first year, maybe in their second or third year. Don't do what I did. Don't waste your time. Start studying from the first year itself. Even if you're short of sleep, just take 1 hour or half an hour to read on some important concept. Definitely it will help you, because at the end of the third year you don't want to feel like you don't know anything and you don't know how to treat anything, because that is your main goal. Not cracking exams, is your main goal is treating patients and getting them better.
True. Exactly
That's
correct.
what I want to say. Yeah.
Yeah. Thank you so much, dude. Thank you.
Yeah, sure.